it's been established that we need blood already. That is not in question. But I want to ask, the method of collecting blood, is it the same in other countries as it is here? Because the way people shy away from it, you think that it's super painful here.
Oh, well, the method is a standardized method of collection. It's an aseptic procedure, meaning we're not likely to introduce any infections into even the donor. And maybe some things that might differ, like you said, the pain, but it's just a millisecond of pain introducing the needle into the vein. Maybe in other climes they might use certain anesthetic agents over the surface, just a topical anesthetic agent to reduce that. But basically, it's the same process.
So it's not painful except that initial prick?
No, it's not, except the prick.
Okay, Nigerians, you hear that? It's not painful. Now, when you take blood, what kind of blood-borne infections are you trying to screen for? What are you trying to exclude from the blood?
Okay, the WHO actually has some blood safety guidelines. Majorly, the blood must be screened for HIV, hepatitis B, hepatitis C, and syphilis. And that's it? After that, everything is okay? After that, everything is majorly okay. Majorly? Yes. Those are the four that must be screened for.
Now, that brings me to my next question. You see, whenever I read about blood-borne diseases and transfusions, and they're talking about how aseptic and clean the method is, they say lower risk, low risk, but nobody ever says no risk. So what's the risk? What's that little bit left? Okay, for something like HIV and even the hepatitis, that's what we call a window phase for viral infections and all of that. So if the individual is in the window phase and he's just acquired the infection and hasn't had, as in the body hasn't had time to, like the antigens haven't had time to replicate, the body hasn't had time to produce antibodies against that, then there might be that small risk. Although we use the government labs generally use third to fourth generation ELISA screening methods, which have high sensitivity and specificity. That's the test, right?
Yes, that's the test that screens those. And those tests test the antigens and the antibodies, presence of antigens and the antibodies. So, yes, there's a much reduced risk of infection.
Do we have those super sensitive tests here in Nigeria?
Yes, we do. Even in Luth, we do.
Okay, now, I just want to, paint a scenario. Correct me if I'm wrong. If we are having enough donations of blood, at least 1% or maybe 2%, wow, of the population is donating blood. Okay, a phone call is coming in and I have to answer that before I continue. Hello, who's with us today? Hello? That phone call is not coming through yet, but we're waiting for you. Now, 2% maybe, or 1% of the population is giving blood regularly. If that happens, could it be that there'd be enough blood for it to be kept throughout whatever window phase is necessary and then tested again so that that possibility of blood-borne infections will now be nil? I don't know if you understand what I'm trying to say. That the blood is so much that whenever anybody comes, the blood you're giving him is like maybe 6 months old and it's been tested again, so nothing could have built up in it as an infection.
Okay, point of correction there. No blood collected, no whole blood collected will be kept for 6 months.
Okay. 6 months is too long? Does it get bad?
Yes, it's too long. Yes, it has an expiry date, which is why we need regular donations from several people at different intervals, so that at each point the blood bank is full. I won't say, okay, everybody come on January 1st and donate and all the blood gets expired all at once.
Okay, let's see if we can get that phone call now. Hello? Hello? Well, we'll have to continue until the person gets through.
Okay, so there's an expiry date for the blood, like I said. And,
so how long do you get to keep blood?
On the average, about 35 days.
That's just
Like
over a month?
Just over a month. Yes, that is why we need...
Have you ever had to throw blood away? I mean good blood, because it expired.
Yes, that happens occasionally.
Even
occasionally,
here?
Yes, even here.
But you know, that how does
Especially in situations, maybe there's a strike and not so many people accessing the blood products and all
now it's making sense, because the impression we're getting is that blood is really needed. Yes. So if blood is needed, that means everything you get should be used up.
Yes, well, depending on, also there's so many factors that go into this, really, depending on availability and requests, depending on the specific blood groups that are needed and all of that. So sometimes a few, just a minute percentage, might be discarded subsequently.
Okay, so you were talking about the World Health Organization, and they always talk about strengthening blood systems. How are we strengthening our blood systems? Can we, for example, go and donate blood safely in the primary health care center next door or down the street?
No, because in addition to collecting safe blood, we also have to store blood appropriately. So what is usually done is usually in a secondary or tertiary hospital that has an available blood bank. Also, the institutions also organize mobile donor drives in which we go to, where there's a large population of people or a community or an institution that wants to donate blood to us. So we can do mobile donor drives, go there, collect the blood safely, transport it on ice packs, and take it back to the blood banks.
Okay, talking about these ice packs, that means the blood has to be kept cool at a certain temperature.
Yes.
How possible is that here?
It is
with
possible.
Our outages.
We do that very often. Okay. With the outages, of course, the blood bank is backed up by the generator systems and all of that. So generally, we keep our blood at the correct temperatures of 4 to 6 degrees Celsius. Okay,
so you've established that blood donation is reasonably safe?
Yes.
Transfusion is reasonably safe?
Yes.
Tests are sensitive enough in Nigeria. But if somebody really wants to donate blood, the question comes up, where do I go? Do I just get up one free morning and go to Luth? How does it happen? Do you call? Do you write a letter? What do you do? Because a lot of the time, some people are willing, but they just don't know what to do.
Okay, you're correct about that. Actually, you can just walk into the blood donation center, the blood donors.
Does every hospital have that? Every tertiary hospital?
Yes, most tertiary hospitals have that, at least.
Can you, for example, go to a private hospital for that?
For blood donation, no, that's not typically what they do in private hospitals, except it's a private blood bank.
Okay, so the private hospitals, where do they get their blood from?
Lagos State, for instance, ensures that all blood that is used in private hospitals must be gotten from either the Lagos State Blood Transfusion Service or from Luth.
Okay, that is a Lagos State law.
Or a federal, yes, it is.
All right then. So, because I'm trying to establish here where people sometimes say, okay, he needed blood, but they couldn't find any, and they were going all around. Is there a system of, this person needs blood? For example, he's in, maybe he's in Ajangbadi, or he's in Ikorodu, and then some sort of network by which they will know that the kind of the blood type he's looking for, they're looking for this patient, is at so and so hospital nearby. That kind of network.
Yeah, there is an informal route which we do from time to time in our institution. You can contact another government institution by phone. Just one of the people working there, and you can ask, oh, is this blood type available? Is it not? We have patients that are coming over and all of that. But there are also private bodies that are coming up and trying to really network the blood and know that, okay, yes, the blood is available in A, and they can even transport it to Z, where the blood is needed.
Okay, our time is up. Dari was asking what's in it for him as a donor, since he's not being paid.
What's in it? Oh, there's so much in it for him.
Just mention one, and then we close.
It's a selfless act of humanity. You're saving a life, or possibly more than one life.
More than one life. Okay. Thank you so much for coming. We could have spoken more, but time is up. Thank you for your insightful answers and discussions. And thank you, viewers, for trying to call through. Thank you, Dari. We got your tweets. Have a wonderful day. I am Mary Alale Yusuf.